Hello, my name is Jay Gottlieb. I'm a dermatologist here at Miramar Dermatology Skin and Cancer Associates. Let's talk about basal cell carcinoma, the most common cancer known to man. The good news is this particular cancer does not kill you. The bad news is once you've had one basal cell skin cancer, the chance of getting another one is pretty darn high. They tend to run in families. There's a genetic predisposition, but the sun is the trigger. Many times patients will have a lot of sun and they never develop a basal cell skin cancer. It's just not in their genes. However, some patients will have moderate amount of sun and develop many basal cell skin cancers. Even though these are not life-threatening skin cancers, they must be treated. They can become very locally invasive and aggressive. So what does a basal cell skin cancer look like? It can have one of a few forms. It could be a raised red area that just doesn't seem to be healing. It may even bleed at times. They're rarely tender. They can be a flat area that's red and irritated and just doesn't seem to heal. They usually occur on sun-exposed areas. If you notice one of these, they should be checked out by a board-certified dermatologist. When we see a lesion that appears to be a basal cell carcinoma, we do a biopsy. One of two types of biopsies are done. We can do a tangential biopsy, which is simply a shave where we take off a small amount of skin and send it to the pathologist. Occasionally, depending on the location, we'll do what's known as a punch biopsy. This is a very, very small 2 to 5 millimeter punch that looks like a cookie cutter, and we take out a core of skin and put in 1 or 2 stitches. Depending on the area where this is located will determine the type of treatment that we recommend. One type of treatment is called a desiccation and curettage, a burning and scraping technique. It's painless. Relatively small amount of anesthesia is necessary, and the procedure itself causes no discomfort. Again, depending on the location, we may recommend a surgical excision. My background is facial plastic surgery. I'm board certified in dermatology and facial plastic surgery, so most of the time I will offer my treatment to my patients. Rarely do we need to send a patient to another doctor for this type of a skin cancer. They can occur anywhere on the body, but of course we would expect them to be mostly in sun-exposed areas. I hope that this has helped and answered a few of your questions. There's other places on this website where you can visit and find out more about basal cell skin cancer. If you think you have a basal cell skin cancer, see a board-certified dermatologist. If you would like to come to our office, you can simply click the patient registration tab on the website and register, and then click the Contact Us button and request an appointment. If you're a little old-fashioned, you can call our phone number, 954-447-3200. I hope that this has been of help, and I look forward to meeting you. Thank you for visiting our website.